5 dangerous warning signs you should not ignore about your period. Excruciating pain, feeling faint or dizzy, too heavy period, too scanty period, not getting your period at all. Hello guys, welcome back to my channel. If you're seeing me for the first time, I am the Wonga Nation president, the celebrity stenographer. Most people want to talk about how painful their periods are without realizing that it is not normal at all. Auntie, that thing that is happening to you is not okay. Why is it that every time you're on your period, they need to take you to the hospital for you to feel better? Why is it that every time you're on your period, you need to change pads every 1 hour, or you need to change your tampon every 30 minutes? Why is it that every time you go on your period, you faint? Why is it that you can stay 3, 6, even 1 year without getting your period? Not as if you're on any medication. This is naturally, you are not getting the period at all. These warning signs can be indicative of something happening with your fertility. These signs can also affect your daily life. So why are you leaving it unattended to? Just imagine you woke up one morning and you couldn't see anymore. You will run to the hospital. So why is it that you've not seen your period for the last 6 months and you think it is okay or something to be laughed about, especially when you've done pregnancy tests and it came out negative? There is not much education surrounding topics like this, and also people don't get to bother about things like this until they are ready to have babies. That's when you will hear somebody say, when I was growing up, I can stay 1 year and I've not seen my period. And what has been done about it? Well, nothing has been done about it. I thought it was normal. How could you think it was normal in the first place? Having slight pain or cramp during your periods are quite normal, and these pains are usually caused due to contraction and relaxation of the uterus. They are also influenced by hormones, prostaglandins. These prostaglandins would usually cut off oxygen to your uterus, making them to contract and relax during your period, and that's the reason why majority of us will get cramps. But if this moves from cramps to excruciating pain, where you will be needing a lot of medical attention when you are in your period, or you cannot go about your daily life like you would usually, then that is not okay. It is a warning sign and you need to see a gynecologist for it. You are expected to lose 20 to 80 mils of blood in each of your cycle. If you are changing pads every 1 hour, there is a chance that you are losing more than that. Clots also matters. A lot of us will ignore clots, but it also matters. When I'm talking about your reproductive health, I am not only talking about your ability to conceive or your future fertility. I am speaking about your health at the moment. Why do you think that having a clot that is as big as a baseball is okay? That is a big warning sign. That is ping or warning sign for you. During your period, you don't require sanitary products. You don't use any sanitary product. All you need is probably a thin layer of panty liner, and your period just stays, maybe the spotting just lasts for 1 day and that's the end of it. Your period should last between 2 to 7 days. You should have at least 1 day that you require a sanitary product to put on. If it is not happening like that, then there is something going on that needs to be investigated. Every time you go on your period, everybody around you will need to be on alert because you're going to faint. And you know, majority of us don't know how to take care of somebody who has just fainted. They will come and pour you water. They'll come and shake you. Then after a little while, you wake up again. You'll be like, oh, that's how my own period used to happen. No, anytime I'm in my period, I will just faint. They will wake me up and I will be fine until you are quarter to going back to your creator, because that can happen to you one day and you will not be able to wake up from it. Certain things that can lead to you having those signs during your period. Number 1 is lifestyle changes, and number 2 is medical conditions. Lifestyle changes and environmental factors that can affect your period are things like age. For children who are entering into their puberty, with time, things would usually even out and your period becomes a lot more regular. And for those who are perimenopausal, usually that will be leading into menopause and then postmenopausal phase where you won't be able to get your periods any longer. Pregnancy naturally ceases your period. So if you don't get your period for a long time, then you have to do a pregnancy test just to make sure that it is not pregnancy. Stress, lack of sleep, traveling to a new environment, making use of new products that has a lot of chemicals or endocrine disruptors, eating foods that are not rich in nutrients can also affect how your period comes. So you can get it heavier or even scantier. If you have watched this video to this point, it means that you love what I do here, and I love you as well. If you have any questions based on the topic, please ask in the comment section. If there is any topic you would want me to talk about, especially when it relates to fertility as well as ultrasounds, ask them in the comment section and I'll be more than happy to take them. If lifestyle is the reason why your periods are not okay, usually change in lifestyle choices will make things better. For example, if you are not maintaining a healthy weight before, maybe you are overweight or underweight, when you suddenly start maintaining a healthier weight by eating right, exercising, and also reducing stress and sleeping properly, you will notice an improvement in how your periods come. You will also notice that if you moved from one environment to another, your period can change the way they come. Maybe the number of days can reduce or even be more. With time in that new environment, your body is going to recognize the new place, and then your period would usually go back to normal. If the changes in your period is not due to lifestyle choices or environmental change, then there are medical conditions that can be leading to this. These medical conditions will be requiring a doctor to assess you and then tell you management plans as well as treatment plans that will make things better. Medical conditions that can affect your period. Number one is fibroids. Fibroids are mass of muscle tissues that affect the reproductive system of women. Fibroids can be symptomatic and sometimes they are asymptomatic. Asymptomatic fibroids are the ones that will not affect your cycle or your periods in any way. But symptomatic fibroids can lead to heavier periods, bleeding in between your periods, and also painful periods. Endometriosis. Endometriosis is when the cells that should be inside of the lining of your womb are growing somewhere else. So when you are getting your period, those cells outside will also start shedding, making your periods a lot more painful and also heavier. Polyps also lead to you having what? Heavier than normal periods. Another one we are not going to neglect is infection. When you're having pelvic infection or pelvic inflammatory diseases, then seeing heavier periods, spotting in between your periods as well as painful periods, and also spotting after sex is something that you can notice. If you're not sure about why you are having all those signs during your period, start with changing lifestyle. Maintain healthier weight, eat healthier, make sure you're well hydrated, and if the symptoms persist, ensure you speak to your gynecologist immediately. And if you're seeing me for the first time, I am the Wonga Nation President. Hit that subscribe button and also make sure that your notification is on at all times. I'll see you guys again in my next video. Bye.